So ACL reconstruction is a procedure which is done following an injury to the cruciate ligament. Just to give you an idea that in human body, in the knee, there are two cruciate ligaments. They make a kind of a cross like this. One is at the front, which is called the anterior cruciate ligament, and there's one at the back, which is called the posterior cruciate ligament. So in simple terms, it is kind of a very strong rope which controls how much your knee moves from front to back. Okay. So in certain sporting injuries, it can happen that the knee can get damaged and the cruciate ligament can get torn. In order to reconstruct that cruciate ligament, we use different type of tendons from the patient. It could be the hamstring tendon, it could be the patella tendon, it could be the quadriceps tendon, and there are a few other either artificial grafts or donor grafts which are available. It all depends on the patient, which type of graft which we use. Okay. ACL reconstruction, it's a successful operation, and in simple terms, what we have to do is to debride the broken or the ruptured part of the ACL, and then drill a couple of tunnels, one in the shin bone, one in the thigh bone, and then pass a graft and then hold it in those tunnels with either using a screw or an anchor, and it all depends on patient on the preferences. So I usually recommend ACL reconstruction to my patients when they have symptomatic instability. And what does it mean by symptomatic instability is that when they do not trust their knee. So if they tell me that, look, when they are running and they're suddenly trying to change the direction, then their knee will give way, or they can fall. Or if they lose trust in their knee for doing any pivoting or any cutting activities or sports, then I think that's the time to reconstruct their cruciate ligament. This indication is mostly for the patients who are very active and they wanted to take part in the sport. However, we also know that cruciate ligament controls how much the knee moves from front to back. So if in the absence of cruciate ligament, sometimes patients are at higher risk of getting tears in the menisci, in the shock absorber, just for the reason that the knee moves a lot and it can result in meniscal tears. So again, one reason to reconstruct is to get the patients back to their sporting activities. And the second important reason to reconstruct the cruciate ligament is to avoid any further damage to the structures inside the knee. Not really. It's not a major operation, but we do take all care to do the good job. If I explain to you in simple terms, I've got a knee model here. It's just a sawbone, and I'll see if I can show it to you. So you can see. Let's just put it the right way around. So this is the thigh bone, and this is the shin bone. Okay. Now what you can see here in the middle here. So this is the cruciate ligament. So what we have to do the cruciate ligament reconstruction, I've put it into 5 steps. So first of all, we need to have either a graft coming from the patient own tendons. So as I mentioned to you, either the hamstring tendon or patella tendon or the quadriceps tendon, or you can have a donor graft. Very few people use an artificial ligament in the European countries. So you need to have that graft. So once you harvest that graft, then you need to clear with the keyhole examination. So if there is any stump, the bits of the previous original cruciate ligament, you debride them. Then you drill a tunnel into the thigh bone, and then you drill a tunnel into the shin bone, and then you have to pass that graft through those tunnels. And then as a last step, you attach it with a screw or kind of an anchor there. So those are the steps of cruciate ligament. So again, it's not a major operation, but again, it is an operation which can help patients return to their activities. The recovery, the patients usually starts walking the same day. They can return to their normal activities in the next few weeks. However, if we are thinking about returning to all the sporting activities at a high level, that can take from 6 to 9 months before they can before there are no restrictions at all. But rather than putting a time frame, I usually discuss it with the patient along with the physiotherapist. And we usually follow not a time-based approach, it's a function-based approach that once they achieve a target on the rehabilitation, we move them on to the next part. But overall, it can still take around 6 months or so. But there's a good chance, as I said, that depending on what symptoms the patients have, there's a good chance that once after successful ACL reconstruction, you will be able to get back to all the activities which you do. So there's a good chance it will recover back to normal. Now, one thing we have to bear in mind is that if you delay the ACL reconstruction and then you have additional damage inside the knee, for example, if there is any damage to the cartilage or the meniscus, then reconstructing the cruciate ligament will make the knee stable, but unfortunately, it will not reverse any of the other damage which has been done inside the knee.